We're now joined by Dr. Ronald Nahass, president of ID Care. Good to see you, Dr. Nahass.
Good to see you, Steve. Thanks for having me on.
You got it. Tell everyone what ID Care is.
ID Care is a large single specialty infectious disease practice. We have locations in over 130 sites in the state of New Jersey, 10 offices, 16 hospitals, and over 100 long-term care facilities in which we see patients with infectious diseases.
So let's talk COVID, let's talk public awareness, and let's talk, let's say, some miscommunication or messaging issues. My question is this: to what degree do you believe that the public health community, the leadership in the public health community, has been effective and consistent in their messaging to often very confused citizens as we tape this program at the end of June 2021?
I think that's been one of the challenges for not only our public health officials, but the politicians. I think those in leadership have struggled to be able to have a uniform message. And that's been one of the biggest challenges for those of us that do this work out at the front lines. It's certainly been one of the biggest challenges for us. That is managing the information. The information's coming at you like water out of a fire hydrant. It's extraordinarily difficult to separate out what's important, what's real, what's misinformation. And honestly, our public health folks and our politicians haven't always done a great job. They just haven't.
How much does it bother you when, quote unquote, politics gets involved and mucks up, if you will, conversations about science and public health regarding COVID?
Well, it's been terrible because the politicians have the bully pulpit, so to speak. And if you have a microphone and you don't know or are not sure of what the details are that you're speaking to, you shouldn't comment, because it really creates confusion for the public. It creates confusion for providers. It creates confusion for all of us, honestly, in trying to carry out a uniform approach to something that's been so catastrophic. Now, it's not to say that the information is always clear. It's not. That's the problem of pandemic. But that attempt at messaging confounded or confused it even further.
So, you know, it's so interesting you just said that, because as a student of leadership, I often wonder, when a leader, whether in the public health arena or in government as an elected official, appointed official, whatever, if he or she simply does not know, if the scientists do not know, because it's a novel coronavirus, do you believe it's acceptable and in fact appropriate at times to say, we don't know? We're trying to find out, but we don't know right now. Go ahead, I'm sorry.
Yeah, that's absolutely the right thing to do. I think that's one of the first principles of disaster communication or pandemic communication is say what you know when you know it, but say what you don't know. And if you don't know, that's way better than speculating or suggesting something else, because it just adds to further confusion. So totally on board with that. I think that's an absolutely critical principle of how we need to communicate in this kind of a setting.
You believe in so-called vaccine passports?
Now, I think a vaccine passport is an important concept that should be fleshed out and should be considered strongly. We have precedent for this. There are several examples that we've had for many decades, in fact. For example, most listeners, I'm sure you're familiar with the fact that you can't have your child in public school without having a measles, mumps, or rubella vaccine. That's a passport. In order to go to public school, you got to have a vaccine. If you want to travel to Central Africa or South America, you must have a yellow fever vaccine, and you actually have to get a card, an international certificate of vaccination for yellow fever, in order to go to those countries. That's a vaccine passport. So I think for the purposes of public health, public safety, and just good overall care, vaccine passports have a role. And in this case, for a pandemic, absolutely.
Devil's advocate, some people watching right now, people I know, people you know, say, and I've asked this of so many public health experts, infectious disease experts like yourself, It's my right not to get the vaccine. I don't want to, and the government's not going to tell me I have to. Okay. The consequences of that are?
Then you cannot participate in public activities. The concept of personal rights is important, and I'm all for it, right? We should all have our individual rights. However, if that individual right infringes on others, that's a different story. So the example that I've used is a tetanus vaccine. Let's use that as an example. Tetanus is a disease you get from the proverbial rusty nail or a dirty item outside in the yard, and you injure yourself. You don't want to get a tetanus shot if you get exposed like that. That's okay, because if you get tetanus, you can't transmit it to me or to you. But tuberculosis, yellow fever, COVID, measles, mumps, those are diseases you as an individual can transmit to somebody else. So your decision to not take a vaccine affects me, affects my family, affects your friends. And so it's not solely a decision for you. It's a public decision that we're in together.
How concerned are you about a recurrence of a significant surge, again, of COVID cases?
Well, you probably saw the stories of what's going on yet again in South America.
With the Delta variant?
Yeah, different variant in South America. And we're now seeing a mini surge, down in certain states of the country where vaccination rates are low. Will we have a major surge like we had in the beginning of the COVID pandemic here in the US or this past winter? No, because we've had a fairly substantial portion of the population that's been vaccinated. But the risk is that the reservoir of unvaccinated individuals that could harbor the virus result in a variant that mutates, that could then infect those of us who are vaccinated, is a potential real occurrence. Will it occur? We do not know. But what we do know is that that possibility exists, and we've seen that happen in India. We've seen that happen in South America. What we don't want is we don't want that to happen here. We all need to get vaccinated.
Well, Dr. Ronald Nahass, who's the president of ID Care, an infectious disease specialist, and I want to thank you so much for joining us and sharing your perspective and insight. From our vantage point, particularly those of us involved in public broadcasting, this is a purely public health question. It's not about politics, not about anything else. It's not my opinion, it's just a fact. So we're here to provide the facts, and you decide for yourself, but it's not just for yourself, as Dr. Nahass said, it's other people as well. Thank you, Dr. Nahass.
Thanks, Steve, appreciate it.
You got it. I'm Steve Adubato, we'll be right back.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation. Funding has been provided by the Turrell Fund, supporting Reimagine Childcare. PNC, Grow Up Great. PSE&G, the Healthcare Foundation of New Jersey. The Fidelco Group. Horizon Blue Cross Blue Shield of New Jersey. New Jersey Institute of Technology. MD Advantage Insurance Company. And by the New Jersey Education Association. Promotional support provided by NJ.com. And by the New Jersey Business and Industry Association.
New Jersey's early educators and childcare providers are more than twice as likely to live below the poverty line versus the general workforce. Reimagine Childcare, formed by a coalition in New Jersey, is dedicated to improving accessibility, affordability, and quality of childcare and reimagining the way we support these essential providers. Learn more by visiting reimaginechildcare.org.